My dear seniors, today I want to share something that may completely change the way you think about your health care. Something that I have witnessed for years from inside the medical world. And I'm going to be very honest with you because you deserve nothing less. There is a hidden reason why so many doctors keep you on pills for life. And it's not the reason you might think. Because while we are taught to believe that every prescription is written solely for our benefit, the reality is that the system we work in is designed in a way that rewards ongoing treatment far more than it rewards a cure. And I've seen this cycle again and again. A patient comes in with a health issue that could be improved, even resolved, and then with lifestyle changes, nutrition, and a bit of patience. But instead, the first solution offered is a prescription, and once you start taking that pill, it often becomes a lifelong companion because your body may adapt to it, depend on it, or develop side effects that require more pills. And before you know it, your health becomes a carefully managed balance of medications rather than a path toward freedom from them. And here's the truth you're not told. Keeping you on medication indefinitely creates predictable, recurring income for pharmaceutical companies and for the broader healthcare system. And I'm not saying your doctor is sitting there rubbing his hands in greed. Most doctors genuinely want to help, but they are trained, influenced, and guided by a medical culture that prioritizes prescription-based solutions, reinforced by a system that rewards it. And my dear friends, this cycle is not accidental. It's baked into the structure because pharmaceutical companies invest billions to ensure doctors are educated in ways that favor their products. They sponsor medical conferences, fund research, and supply the very materials doctors use to learn about new treatments. So naturally, the focus tilts toward solutions that involve their medications. And over time, many doctors stop even thinking about whether you could be taken off the pill entirely. They just manage you from year to year, adjusting dosages, adding new ones when side effects appear. And before long, the idea of being medication-free is seen as unrealistic, even radical. But I want to tell you something that too few people hear. Your body is capable of extraordinary healing when given the right support. And while some conditions truly do require long-term medication, many others can be improved dramatically with consistent lifestyle choices. But here's the catch. That kind of healing doesn't make anyone billions of dollars. It doesn't create lifelong customers. And so it's rarely promoted, yet I have seen seniors regain mobility, reduce blood pressure, improve heart health, even reverse early-stage diabetes by focusing on food, movement, sleep, hydration, and stress reduction, and they did it while reducing or eliminating medications with proper supervision, and the change in their quality of life was nothing short of remarkable. So, my dear seniors, I urge you to ask yourself this. Are you taking that pill because you truly need it or because it has become the easiest, most automatic option in a system that benefits from your dependence? And please understand, I am not telling you to throw away your medications. Never do that without proper guidance. But I am telling you to start asking hard questions, to become curious, to wonder whether the very thing you believe is saving you might also be quietly chaining you to a lifelong prescription plan. And once you start looking deeper, you may find that there are steps you can take to support your health naturally, to strengthen your body from within, to give it what it needs to thrive without as much chemical interference. And in doing so, you reclaim something priceless, control over your own health story, because at the end of the day, you are not just a patient number, you are not just a name on a prescription pad, you are a living, breathing soul with the right to feel vibrant, clear-minded, and free for as long as you possibly can. So don't be afraid to challenge the narrative, my dear seniors, because sometimes the path to true health isn't in adding another pill, but in asking why you were put on it in the first place.